Hello, I am Dr. Isabelle Moreau, a urologist, and today I want to speak to you with all the clarity and closeness possible about a subject that many men over 60 experience in silence. A subject that sometimes causes shame, fear, and is rarely shared even with the closest partner. Today, I want to ask you a direct question. How would you feel if you reached orgasm with all the intensity of pleasure, but without seeing a single drop of semen come out? Maybe it happened to you once and left you perplexed. Maybe it happens to you frequently and you've decided to keep quiet about it. Whatever your case, I understand you. In my office, I've seen men arrive with worried looks, not knowing how to explain it. Some barely whisper it, as if confessing a shameful secret. Others tell me they've even avoided intimacy out of fear that their partner would notice. This emotional burden is as real as the physical changes. And that's why today, I want to invite you to lift the veil on this taboo. Because what happens in intimacy is not something minor. It's part of your overall health, your confidence, and your quality of life. And I have something important to tell you. This does not mean you've lost your virility, nor that your masculinity is in danger. What you're experiencing is a signal from your body, a message that needs to be understood. And in the majority of cases, it can be treated. But stay with me, because in the next few minutes, we'll go through the causes, warning signs, and especially the solutions that science offers us today. 1. Understanding normal ejaculation. Before understanding what happens when semen doesn't appear, it's worth recalling how a normal ejaculation works. Imagine that inside your body, there's a small, perfectly coordinated orchestra. Each instrument plays an essential role, and all must play together for the melody to be complete. Under normal conditions, the testicles produce sperm. The seminal vesicles provide the majority of the nutrient and energy-rich fluid. The prostate, for its part, adds a special fluid that protects and helps transport the sperm. All of this comes together in the urethra, like musicians waiting in the wings. When maximum arousal arrives, the muscles of the reproductive system spring into action. They contract rhythmically and powerfully, propelling the semen outward. It's a quick, almost automatic process, but the result of exquisite coordination between nerves and muscles. Here's something key. Orgasm and ejaculation, although they usually occur together, are not exactly the same thing. Orgasm is the neurological response of pleasure and release. Ejaculation is the physical act of expelling semen. Most men experience them as a single event, but in reality, they are two distinct mechanisms that accompany each other. When both occur, the sensation is complete. Pleasure, relaxation, and the visible evidence of semen. And that's precisely the key to what we're exploring today. What happens when this fluid doesn't appear, even though the sensation is fully present? What is dry ejaculation? So-called dry ejaculation is a condition in which a man reaches orgasm, feels the characteristic pleasure of climax, but observes no semen coming out, or notices it in a minimal, almost symbolic quantity. At first glance, it seems like the body has completed the process fully, as the intensity of pleasure remains. However, something that's always been considered inseparable is missing: the seminal fluid. This difference, though it may seem minor, is what generates the most confusion. Many men tell me in consultation, "Doctor, I felt the same as usual, but it was as if the orgasm was empty." This perception of emptiness is what fuels the worry, and in some cases, the shame of talking about it. It's fundamental to understand that orgasm is a neurological phenomenon governed by the brain and the nerves that transmit the pleasure signal. Ejaculation, on the other hand, is a mechanical act involving muscles and glands. The ducts contract, valves open, and semen is expelled. Generally, they occur together, but they are not the same thing. When the first happens without the second, this confusion arises that disconcerting feeling. Is my virility failing? Have I lost my masculinity? The answer is no. Dry ejaculation does not mean that desire or the capacity for pleasure has been extinguished. It simply means that the body has changed part of its usual functioning. This phenomenon has various causes, some temporary and others permanent. It can be related to medical interventions, medications, hormonal alterations, or even diseases that affect the nervous system or the prostate. The important thing is to understand that behind every case, there is an explanation and often a solution as well. Main cause: retrograde ejaculation. Among all the causes that explain dry ejaculation, one of the most common is retrograde ejaculation. To understand it, imagine a door that should close firmly at the bladder neck during orgasm. When it works well, this door blocks the passage to the bladder and directs the semen outward. But if it remains open, the semen takes the easiest path. It flows back into the bladder instead of exiting through the penis. The result is simple to describe. The man feels the orgasm, but sees no semen. Often, he discovers what's happening by noticing that his urine is cloudier after intercourse, because the seminal fluid has mixed in. The causes are varied. One of the most common are surgeries on the prostate or bladder, such as transurethral resection or laser procedures. These procedures save lives and improve urinary quality, but sometimes alter the coordination of nerves and muscles at the bladder neck. Certain medications for hypertension, some antidepressants, and drugs used for prostatic hyperplasia involuntarily relax this area, allowing semen to reflux. Neurological damage also plays an important role. Poorly controlled diabetes, multiple sclerosis, or spinal cord injuries interrupt the signals that should close the bladder door. I remember the case of George, a 58-year-old patient after prostate laser surgery. He came to my consultation anguished. "Doctor, I felt the same as usual, but it was as if the orgasm was empty." When I explained to him that it was irreversible retrograde ejaculation in his case, but that it didn't affect his potency or desire, he breathed a sigh of relief. He then understood that his virility remained intact. Only the path of the semen had changed. The diagnosis is relatively simple. It just requires a urine analysis performed right after orgasm to detect sperm in the sample. As for fertility, it's true that retrograde ejaculation prevents natural conception. However, there are assisted reproduction techniques that allow sperm to be recovered from urine or directly from the testicles. And for men not seeking to have children, intimate life remains pleasurable and complete. The lesson is clear. Retrograde ejaculation does not mean a loss of masculinity. It's a physiological change that deserves diagnosis, understanding, and, in some cases, adaptation of treatments. 2. Obstruction of the seminal vesicles. Another important cause of dry ejaculation, less known than retrograde but just as relevant, is obstruction of the seminal vesicles. These glands, located just behind the bladder, produce between 60 and 70% of the total semen volume. Their secretion contains fructose and other nutrients that feed the sperm and give them the energy to fulfill their reproductive function. When the seminal vesicles are partially or totally blocked, the semen decreases drastically or even disappears, even though the orgasm persists. It's as if the highway through which the fluid should travel is closed. The pleasure is present, but the semen's path is interrupted. The causes of this obstruction are varied. One of the most common are old infections like prostatitis or urinary tract infections that weren't properly treated and left internal scars. Another frequent reason are seminal stones, small stones similar to kidney stones that block the ejaculatory ducts. There are also congenital cysts in the seminal vesicle area or vas deferens that remain silent for years and manifest in adulthood. Likewise, pelvic traumas or previous surgeries can narrow the semen's passage. Symptoms guide the diagnosis. Some men feel the orgasm as incomplete or with deep pelvic pain or persistent discomfort in the groin. Others notice that the semen appears thicker, reduced in volume, or with small clumps. Sometimes the only sign is infertility without an apparent cause, a common reason for consultation. I remember Francois, a 45-year-old patient who came with his wife after 3 years of trying to conceive without success. He had normal erections and good sexual desire, but noticed his semen was increasingly scarce. A transrectal ultrasound revealed a cyst in one of his seminal vesicles. With endoscopic surgery, we managed to remove it, and months later, his wife became pregnant. The diagnosis requires specialized exams, transrectal ultrasound to see the shape and size of the vesicles, a semen analysis showing low volume or absence of fructose, and in complex cases, pelvic MRI. Treatments vary depending on the cause. Antibiotics and anti-inflammatories if the origin is infectious, endoscopic surgery to remove stones or open blocked ducts, or ultrasound-guided aspiration in the case of cysts. Recovery is generally quick and with very good results. In conclusion, obstruction of the seminal vesicles is a silent but treatable cause of dry ejaculation. Identifying it allows recovery of both sexual function and fertility. 3. Hormonal factors. The third major cause of dry ejaculation is related to hormonal balance, especially testosterone levels. This hormone, produced mainly in the testicles, is the engine that regulates both sperm production and the functioning of the prostate and seminal vesicles. Additionally, it stimulates sexual desire, enhances sensitivity during intimate acts, and participates in the contraction of the muscles responsible for ejaculation. When testosterone levels drop significantly, the system begins to fail. At first, the man may notice that the semen volume is less, or that it becomes clearer, and over time, other signs appear. Decreased desire, less firm erections, less intense orgasms, and even dry ones. On a general level, chronic fatigue, loss of muscle mass, and mood changes also present themselves. It's important to remember that aging itself should not equate to a total loss of vitality. What happens in many cases is hypogonadism, that is, a hormonal deficiency that requires medical attention. This can be primary, when the testicles don't respond adequately, or secondary, when the problem is in the brain, in the pituitary or hypothalamus, which don't send the correct signals. The diagnosis is based on a complete hormonal analysis that includes total and free testosterone, as well as LH, FSH, prolactin, and thyroid hormones. A low testosterone value, especially accompanied by symptoms, is indicative of a disorder that must be treated. Treatment depends on the cause. Testosterone replacement therapy can be administered via injections, gels, or patches, improving energy, libido, and semen production. However, it's not the best option if the man wants to have children, as it can reduce fertility. In those cases, there are alternative medications that stimulate natural testosterone and sperm production. In short, hormonal decline is not just a detail of aging. It's a signal that needs to be addressed. Recovering balance can mean recovering energy, desire, and a fulfilling sex life. Warning signs and associated serious diseases. So far, we've seen causes that, while concerning, often have solutions. However, dry ejaculation can also be a warning of something more serious, a symptom that should not be ignored when accompanied by other signs. First, let's think about urological cancer. Prostate cancer, as it grows, can obstruct the ejaculatory ducts, leading to orgasms without semen or with blood. In more advanced stages, it causes pain during ejaculation and increasingly intense urinary symptoms. Bladder cancer, for its part, alters semen output when it invades the bladder neck or urethra and is usually accompanied by hematuria. Testicular tumors can also manifest as infertility and absence of seminal fluid. The other category is neurological diseases. Poorly controlled diabetes is the most common cause of nerve damage in the reproductive system. Multiple sclerosis, Parkinson's, spinal cord injuries, or strokes interrupt the signal between the brain and sexual organs, causing dry or incomplete orgasms. There are also less common but equally relevant autoimmune and systemic diseases. Lupus can inflame the vessels that nourish the prostate and seminal vesicles. Scleroderma hardens internal tissues, blocking ducts, and sarcoidosis can form granulomas that interrupt seminal flow. When should you consult a urologist immediately? If dry ejaculation appears suddenly, if it's accompanied by pain, blood in the urine or semen, loss of genital sensitivity, weakness in the legs, or persistent fever, all these warning signs indicate a serious problem that cannot wait. In conclusion, although dry ejaculation is often benign, there are situations where it becomes a crucial warning. Listening to your body and consulting in time can make the difference, not only for your intimate life but also for your overall health. Emotional consequences and quality of life. Beyond the physical aspects, dry ejaculation has a profound impact on the emotional life and self-esteem of older men. Many feel they've lost something of their masculinity, or that their sexual performance is no longer the same. This generates anxiety, frustration, and in some cases, avoidance of intimacy. It's common to hear stories of men who distance themselves from their partners, avoiding moments of closeness out of fear of being judged or not feeling complete. The emotional burden can be as heavy as the physical symptoms themselves. Shame and guilt reinforce a negative cycle, affecting confidence and quality of life. However, it's important to understand that all is not lost. The absence of semen does not mean loss of desire, pleasure, or the ability to enjoy intimate contact. Many men maintain normal erections, intense orgasms, and a satisfying sex life. The first step is to recognize that it's a physiological change, not a personal failure or a punishment of aging. Understanding the cause and seeking medical help allows recovery of peace of mind, self-confidence, and emotional connection with the partner. Accepting and addressing the situation openly is key. Not only does it improve sexual health, but also self-esteem, confidence, and overall quality of life. Practical advice from Dr. Isabelle Moreau. Living with dry ejaculation can be a challenge, but there are practical strategies that help manage the condition and maintain confidence in intimacy. First, never ignore sudden changes in your body. A sudden onset of dry ejaculation or any associated symptoms like pain, blood, or decreased desire requires an immediate consultation with a urologist. Controlling chronic diseases like diabetes and hypertension is fundamental, as they directly influence sexual function and the nervous coordination necessary for ejaculation. Maintaining a healthy lifestyle helps prevent complications. Regular exercise, a balanced diet, and adequate sleep strengthen vascular and muscular health. Another key piece of advice is to break the silence. Talking with your partner and a specialist not only clarifies doubts, but also reduces anxiety and improves intimacy. Understanding that dry ejaculation is a physiological change, not a personal failure, helps recover emotional tranquility. Finally, following medical instructions and attending periodic checkups allows for adjusting treatments, improving sexual function, and when necessary, exploring assisted fertility techniques. The combination of early diagnosis, healthy habits, and open communication is the best strategy for maintaining a satisfying, intimate life and preserving masculinity without guilt or fear. In summary, dry ejaculation is not a sentence of lost masculinity, nor the end of sexual life. It's simply a signal from the body that deserves attention, understanding, and, in many cases, treatment. Understanding these causes, whether surgical, hormonal, obstructive, or neurological, is the first step to recovering peace and confidence. I've seen men who, after receiving a clear diagnosis and medical guidance, regain their self-assurance and enjoy intimacy without fear or shame. Cases like those of George, Francois, or Charles show that although the path may require adjustments or interventions, vitality and pleasure remain possible. Listening to the body, attending regular checkups, and maintaining healthy habits strengthen not only sexual function, but also overall health and self-esteem. Don't let silence or resignation control your intimate life. Speaking, informing yourself, and acting in time can transform the experience, restoring confidence, well-being, and emotional connection with your partner. If this information has been useful to you, leave your comments, share your experience, and remember, consulting a specialist and understanding what's happening in your body always opens the door to solutions and hope. Your masculinity and intimate life can always remain full and satisfying, even in the face of dry ejaculation. Dr. Isabelle Moreau, for your masculine health. If this video has brought you value, don't hesitate to share it with someone who might need it. Together, let's break the taboos and help men live fully, without shame or fear.